Okay, hi everyone. Welcome to the first webinar in our series Converge to Transform. Among our goals here is to bring together as many people from the CUNY scientific STEM research community and beyond to talk about some of the most important research areas that can have an impact, positive impact on society. And this was originally conceived as a two-day in-person symposium at the ASRC, which would have been held today and tomorrow. And thanks to the efforts of many people, especially I want to point out Camille Santisteven, who is our Associate Director for Communications and Marketing, we've reformulated it into a 4-part webinar series. And we're really excited to have you join our first one. Quickly show you the agenda for today, and I will try to keep us on schedule. I know everyone has a large number of Zoom meetings to attend to all of the time, so I'm glad that you're here with us for the next couple hours. I'm just going to say a few words, as little as possible, to give our speakers as much time as possible, and then I will introduce the 4 illustrious scientists from CUNY that are here with us today. After their talks, we'll save questions until the end, have a moderated Q&A, and then we're going to break up into 4 different breakout groups to kind of delve a little bit deeper into some of the topics that are raised during the discussion, and then bring back together at 4 o'clock very quickly for some closing remarks. So with that, I just want to give you a couple reminders as participants today. The session is being recorded. Please keep your microphones muted. We will open up the chat box for your questions after the talks, and we'll try to address those as they come in. And as I said, we'll have a breakout discussion where everybody can participate unmuted and share their thoughts and questions with the speakers and others at the end. So with that, just also want to reiterate my thanks to everybody who helped make this event possible, including our corporate sponsors. And I think most of you here know about the ASRC and the 5 research initiatives that comprise the main bulk of the center. Along with these 5 research initiatives and run by our directors, we also have now created about 15 core facilities, and I use every opportunity I can to advertise how wonderful these core facilities are and that they are available to anyone at CUNY. So if you have not already taken advantage of them, I really invite you to visit our website, where you'll find a lot of information about what equipment is available. You'll find contact information for the core director so you can reach out to and ask questions anytime. Of course, they are not necessarily available for you today, but we hope very soon for that to change, as I'm sure all of you do as well. I also just wanted to say a little bit more about the ASRC before we get started and focus on this session. This event was intended to be a culmination of our 5th anniversary as a center founded by CUNY, and as such, we are now starting our next 5-year strategic plan, which we've finalized, and we've launched a website to share that information about what our plans are and what our goals are with the CUNY community and beyond. And this slide just outlines very quickly what the 5 topic areas, the 5 goal areas are. These 5 goals to strengthen our disciplinary and interdisciplinary research, to integrate ourselves and support CUNY-wide research and education, and form strategic partnerships throughout the New York City area and beyond, all really are part of our overarching vision, which is to improve human, societal, and environmental well-being through interdisciplinary research and education. And embedded in this and throughout our strategic plan, what we acknowledge is that in order to successfully address the most pressing challenges of society, we really need to be bringing together scientists across all disciplines I should say, researchers across all disciplines, because it isn't just science that we need in order to address these problems, but also the humanities, also many other disciplines. And we need to work together creatively and collaboratively, and we need to nurture a diverse and inclusive culture. And that's one of the things that drives us to, for instance, make our core facilities available to everybody within CUNY. And it's also what drives us to host events like the one that we're doing today. So it's very encouraging for me to have seen from the registration list, this is as of 5 p.m. last night, that we have representatives on the webinar today from at least 16 different CUNY colleges. And that we have representation across a lot of different departments within those colleges as well. So as I said, science does make up a big part of it, but we have people who are in fields from technology, engineering, arts, math, and medicine as well. And I think it's bringing that wide range of expertise together that's going to allow us to generate the most impactful and interesting dialogue on these problems and really find the best solutions to address them. So with that, I want to transition to just say that I thank you all again for being here today, but we will also have a few other webinars coming up in this series. Today, we're going to be focused on COVID-19 research and various different approaches and issues that has brought up in our society. In the future, we're going to be looking at 3 other impact areas. The next one, which will be on May 26th, is going to be looking at sustainable energy and how we can innovate in that area. This slide is highlighting in particular advances that are coming from CUNY in solar energy, which will be one of the topics discussed that day. On June 9th, our 3rd webinar, we are going to be looking at research that addresses the unique stressors that occur in urban environments, very relevant to all of us in New York City, how that impacts our health as well as that of other animals, plants, and even the microbiome in various parts of urban environments. And then finally, our 4th webinar on June 23rd, we'll be looking at creative approaches that co-opt or manipulate naturally occurring biological properties in order to design new treatments, new therapeutics for diseases that range from cancer to psychiatric illness. So I think these are all, I hope you'll agree, very important areas of research, things that are very close to our human existence. And I hope you'll be able to join us for those. So I don't want to delay any further. I want to give our speakers enough time. So I'm going to be turning the screen sharing over to our Associate Vice Chancellor, Tamera Schneider, who's joined the CUNY community last fall, just in time for all of this craziness. Dr. Schneider received her Ph.D. in psychology from SUNY Stony Brook. After doing a postdoc at Yale, she joined the faculty at Wright State University, and then worked at the National Science Foundation, where she oversaw many funding programs and helped develop philanthropic partnerships. So with that, Tamera.
Okay, we'll try this one more time. So I did want to give you a little bit of background. So I'm just, I know Nina mentioned a few things. I'm going to give you a little bit of a background about me. I will talk a little bit about the beginnings of the ASRC. And having not been here, I really wanted to rely on my notes for that. And then I wanted to talk a little bit about convergence research. So first of all, as Nina mentioned, I got my PhD down the road at SUNY Stony Brook, and my focus was in social and health psychology. And I focused on cardiovascular psychophysiology, as well as getting a minor in quantitative methods. And then I went on to a postdoc at Yale University, where I focused on persuasion theory and applying that theory to promote health behavior change, particularly in minority women. We focused on cancer screening behaviors. Then I became a professor at Wright State, which is in Dayton, Ohio. So going really back home, that's where I'm from. And was a professor there until I joined you all here at SUNY, where I have an appointment at Baruch, which is a place I visited a couple of times. I've been pretty busy since I've been here at CUNY. So at Wright State, I studied stress resilience, focusing a lot on individual team performance, how we interpret stress. Stress, by the way, is a good thing. There's bad stress and there's good stress. So it's not all bad stuff. And really focus on the affective or emotional component of stress, how it gets under our skin to make us not well, to make us sick, and to make us perform poorly, whether individually or in teams. I've also done work looking at all kinds of behavior change, not just health behavior change, but behavior change as it relates to taking care of our planet, and other types of behavior change. So also have looked at broadening STEM participation, oversaw research for a large NSF grant that included 4 different schools. And that was a 5-year project. And then I joined the Multicultural Affairs Office at Wright State, which you probably don't need to know necessarily, but I joined the National Science Foundation. I was on loan to the National Science Foundation as a program director for the social psychology program. And in that capacity, I oversaw the federal funding for our social psych program. It was about $10 million a year. And of course, we leveraged resources in other areas so that we could increase our funding for our colleagues. I worked across different directorates as well. Before my first year was up, I became acting deputy director for the Behavioral and Cognitive Sciences Division of the Social, Behavioral, and Economic Sciences Directorate, and then was in that program as the deputy director. I was hired into that and did that for the remaining time that I was at the National Science Foundation. So at the National Science Foundation, I was hired as through an interpersonnel agency agreement with my university, and those have a hard stop at 4 years. I did go there an extra year. I stayed an extra year, and darn it, I'm not getting sorry, I emailed this to myself and oh, there it is. Yay! Technology, it's such a great thing. Sorry, I have a dog too, by the way. Anyway, so, one moment. Hi. At the National Science Foundation, I had an opportunity to do a lot of work across different directorates. Part of that was related to developing one of the first solicitations for these big ideas that the director of NSF had, the future of work at the human technology frontier. And I'll be using what I've learned in that experience and tell you a little bit more about convergence research. That's why I'm very excited about convergence research. So there we go. So the ASRC, as many of you may recall, or some of you may recall who were here at the time, the goal of the CUNY Decade of Science was launched in 2005, and it was to reinvigorate CUNY's commitment to the future of scientific and technological research and innovation at CUNY. And a great deal has been achieved across the university in subsequent years. And there's been a really impressive expansion of our research capacity through the recruitment of new faculty, through the collaborations with faculty, through collaborations with industry and philanthropic partners. The construction and renovation of these incredible facilities, thank you for highlighting those, Nina. The ASRC, I mean, it's an incredible piece of art. I'm just going to say that, where science is done. So the ASRC really has notably enjoyed, I'll say, an increase in funding from external grants and contracts, and has really strengthened our student pipeline. So it's an incredible resource. There are greater numbers of our undergraduate students who are enrolling in STEM disciplines and are being given the opportunity to participate in really meaningful and transformative research experiences because of this investment. The area or the idea for the ASRC was conceived early in the decade of science, and particularly when it became clear that a single cutting edge facility would really help CUNY to conduct transformative research in a more focused way and become a more entrepreneurial university. So the goal was to bring together brilliant and creative researchers in a select number of important disciplines, and you all know, environmental sciences, nanosciences, neuroscience, photonics, and structural biology, and provide them with the most advanced, and again, I'll just say artistic facilities available. Faculty Advisory Committee was charged by the Chancellor at the time to identify the most vital research areas and the instrumentation that would be required to realize the goal of scientific and engineering really transformation. Over the course of 2005 to 2006, there were a series of faculty focus groups, and they were convened to plan each floor of the ASRC. More than 50 faculty members from across CUNY participated in this process. So it was a long, inclusive, and a process filled with love and aspiration and inspiration and hope. So the conception and development of the ASRC was guided by the premise that the university, meaning CUNY in its entirety, can best advance its scientific and research goals by building on existing research strengths, by focusing on emerging areas of science with great promise, and by drawing on the talent of the accomplishments and the achievements of scientists, engineers, and entrepreneurs across CUNY, and by recruiting the best and the brightest minds to join CUNY's transdisciplinary efforts. And as we look to the future, and as we look to innovate, I'm hoping that you will come with me and look toward convergence research. And so let me tell you a little bit about what that means. And some of you may have some ideas about this already. So one of the most compelling movements I was engaged with during my tenure at the National Science Foundation was to move toward growing convergence research. And convergence research is when it's successful. It drives innovation. And it's when different scholars from different disciplinary areas collaborate to address complex research problems, or, and it could be an and, it doesn't have to be an or, that address pressing social needs. And we have so many, and today's focus is on COVID, rightly so. And if you guys say 2 minutes to me, I'm not going to get it. So sorry, because I'm not looking. Anyway, I digress. So convergence research is related to interdisciplinarity and also transdisciplinary transdisciplinary, but it differs just a little bit. Interdisciplinary research synthesizes knowledge and methods from different disciplines, so they're in parallel, whereas transdisciplinary research strives to unify these different intellectual frameworks beyond the disciplinary perspective, but convergence research is a step beyond disciplinary research. So it really is about a full integration of different disciplines. And NSF uses two characteristics for convergence research. One is that it's research driven by a specific and compelling problem. So it could be a vexing research area or a pressing societal need, as I've mentioned. It's generally topically focused, though, in one of those ways. And then there's deep integration across disciplines as experts from different disciplines pursue common research challenges in these areas by applying their knowledge, theories, methods, data, and their research communities and languages become increasingly intermingled. And yeah, I don't have time to reflect on my own experiences collaborating with engineers and physicists, and we use the same words, but they mean very different things, and you all may have experiences like this as well. But convergence research really results in new frameworks, new paradigms, even new disciplines, and solutions that otherwise were impossible. They weren't conceptually possible. From its inception, this kind of paradigm intentionally brings together different people from different perspectives to address and converge on an area or a topic. So as convergence research is driven by a specific problem and inspired by the need to address a specific societal challenge, the Office of Research, you may recall in the spring, working with Nina, the ASRC, launched the Interdisciplinary Climate Crisis Research Grant. And we had an interdisciplinary research grant before, but we focused it on the climate crisis. So the goal, again, of doing this is to make deep inroads into these areas, whether it's vexing problems or vexing research areas or vexing societal issues, to really help CUNY to build and highlight the work that we do. It's our work which transforms not just our lives, but everyone's lives. So these are things that may be of interest to the city, to the state, to the nation, and to the world. And the work that we do, much of it funded by taxpayers, but it impacts the lives of each one of us. And some of the more basic science may not impact people's lives tomorrow, but when we do converge, when we do convergence research, there's more of an opportunity to innovate and to sometimes accelerate basic research into application and commercialization as well. So the ASRC was created to break down traditional barriers in science and engineering. And by science, I do mean that broadly. I don't mean, some people use the word hard and soft. I actually don't prefer those because I like to say, try human science where you have a lot more unknowns than you have knowns. Try predicting what a human will do. But I digress. But, really incubating a culture of interdisciplinarity, collaboration, and the work that the researchers at the ASRC conduct in collaboration with their other CUNY colleagues who may not have a primary appointment at the ASRC will really bring us closer to our goal of convergence and convergence for the public good. And I'm grateful to all of you for the work that you do. Thank you for your work, for your collaborations, for your inspiration. And thank you, Nina, and all for again, being very agile and shifting to this platform. I look forward to today's webinar and for the next 3 that are coming up. So sorry if I went over.
Thank you, Tamera. Excellent. I liked the word emerging and thinking about what the ASRC's purpose is to support emerging needs. And I think that's one of the reasons we wanted to bring this together. The reason we want to talk about COVID-19 research is because it is such an emerging need for all of us today. And I'm really happy that we are bringing together people from epidemiology and public health, in the case of our next speaker, Dr. Denis Nash, from people who are experts in bioinformatics, chemistry, biology, material science, today in the spirit of convergence, bringing all of these disciplines together to really think about how they intersect in answering the questions that are so important right now. So without further ado, our next speaker, Dr. Denis Nash, thank you so much for being here. He is Distinguished Professor of Epidemiology and Biostatistics at the CUNY School of Public Health and Executive Director of the CUNY Institute for Implementation Science and Population Health. He is an infectious disease expert and has worked previously extensively on HIV infection, among other things. So I think this transition from HIV to COVID-19 reminds me of another the illustrious Dr. Fauci. And so I think this is our epidemiological Dr. Fauci in the house. And his talk today is titled Epidemic Intelligence to Inform the Public Health Response to the SARS COVID-19 problem. Thank you, Dr. Nash.
Thank you so much for having me. And I'm gonna try to pull up my slides here. Okay. How's that?
Great.
Okay, good. Thank you for having me at this event focused on COVID-19. I'm trying to enlarge my slides right now into presentation mode. Hopefully that'll kick in. And yes, I'm coming from the CUNY Institute for Implementation Science and Population Health and the Graduate School of Public Health and Health Policy. At the CUNY-wide Institute for Implementation Science and Population Health, a big focus of ours is about, it is very transdisciplinary and sometimes convergent kind of work that we do. It is focused really on trying to bring about improvements in population health, gains in population health through better implementation of strategies that we already know about and that work. And so it does mean bringing together people working in many different disciplines to make that happen. And the example I'm going to talk about today, I think really is at the heart of the kinds of work that the CUNY ISPH does. So I'll just start with a little bit of background. There's been lots of studies about COVID-19, including many cross-sectional studies at supermarkets or on telephone surveys and things like that. One thing that I think is needed in these situations, and which we've had for many health conditions, including HIV and also heart disease, thinking about things like the Nurses Health Study or the WISE and the MAX study for HIV. These are early on, like natural history type studies to really help us understand some of the underlying causes of epidemics and how to mitigate them and how to control and manage them. And so the COVID-19 pandemic really has transformed life all across the US. It's posed medical and economic challenges, and it has resulted in an unprecedented medical and public health response. And there's really a need to investigate and characterize the evolving epidemiology of any pandemic caused by a novel pathogen, especially a deadly one. So we need to understand more about who's most affected and at risk. What is the impact of implementing and relaxing or lifting the different non-pharmaceutical interventions that are in place, such as the stay-at-home orders. We need to understand the impact not only on the SARS-CoV-2 outcomes, but also psychosocial outcomes such as mental health and social support and interpersonal violence. In addition, there's a need to understand some fundamental epidemiological aspects of SARS-CoV-2. What proportion of people with SARS-CoV-2 infection are asymptomatic? Among those who have recovered from SARS-CoV-2 infection, is there short or long-term protection against reinfection and or development of severe COVID disease? There's of course opportunities to study and learn about other pathogen and host-related factors, and the potential to inform the many different mathematical models that are being used to make major decisions about how to safely reopen society for this pandemic and probably for future pandemics. And so cohort studies have the potential to inform and develop in all of these different areas. And so the CUNY Institute for Implementation Science pivoted pretty quickly in March to try to do something and make a contribution in this area of observational cohort studies. We set up our study and provided a link for people to come and join our study on March 28th. And at that time there were about, which seems like a year ago, 466,000 cases and 7,000 cases and 7,000 deaths in the US. People could come and join the study directly through our website, and we also, through referral, and we also placed several ads on social media that brought people into our study. You can see an example of some of the ads here. And we recruited through Facebook and Instagram and other means, really building on some of the internet strategies for recruitment into cohort studies that faculty like Christian Grove and the Together 5000 team at our institute have pioneered for HIV-related research and HIV prevention. And we pivoted some of those methods to do something around COVID. And so we were recruiting our cohort participants right during the upswing of the SARS-CoV-2 pandemic in the US. You can see here the trend in deaths, and below that, the trend in enrollment of our cohort sample. By the time we finished recruitment, we had about 7,000 participants, and you can see here where where they are geographically. They're basically representing all 50 US states, DC, Puerto Rico, and Guam. And if you sort of juxtapose that map of our cohort participants with the maps that show the burden of the SARS-CoV-2 pandemic in the US, there's quite a bit of overlap. And so our cohort participants are coming from areas where there's been a fair bit of active SARS-CoV-2 transmission. So what we've learned so far from the enrollment of these 7,000 participants, they represent not only geographically diverse, a geographically diverse sample, but also sociodemographically diverse sample. 23% of them are age 60 years or over, 25% are non-Hispanic, Black, or Hispanic, 16% were unemployed at the time of enrollment. About 47% of them have incomes less than 50,000, 39% from urban areas. 54% fall into a category of what we would call high risk for a severe COVID-19 outcome, should they become infected with SARS-CoV-2, and that is because of age and underlying health conditions that we know predispose people to a bad outcome, as well as daily smoking. And importantly, even among those in younger age group, in the 18 to 48-year-old age range in our cohort, 38% of the participants fall into this category. So this is not just something that is, and this is why we see it's not just something that's affecting mostly older people. We also have a fair number of healthcare workers and first responders in our cohort. 9% of our cohort are healthcare workers. 5% of them reported that they're doing direct patient care for people with COVID, screening, testing them for COVID infection, or treating them if they're confirmed to have COVID infections. And about 18% of our cohort are other essential workers, such as law enforcement, first responders, people who do food delivery or work in grocery stores or work in the transportation industry. We asked them about, in this first wave of some of the measures, the public health measures, the non-pharmaceutical interventions that we have been asking so many in New York and around the country to adopt in order to protect themselves and others from SARS-CoV-2 infection while we're trying to reduce community spread of the virus. And what we saw is that there's relatively high uptake of non-pharmaceutical interventions in our cohort. 93% reported that they were avoiding large gatherings and handshakes. And we also saw that these measures generally increased with age of the participants. Moving down to the bottom of the table, about 20% of the participants reported that they had COVID-like symptoms in the 2 weeks prior to baseline. This is self-report, but nonetheless, this is a group of participants who are affected by COVID. And we asked a bit further about of those who did have symptoms. First, we saw that 60% of them were at higher risk for severe disease. About 39% of them saw a healthcare provider for their symptoms, and a higher proportion of those, 46% of those at high risk, did so. 12% reported being hospitalized for those symptoms. And of the entire cohort of 7,000, about 5% reported having received a test for SARS-CoV-2. 8% said they tried to be tested but couldn't, and about 2.7% reported a COVID-19 diagnosis, and it was a bit higher among those who are in the high risk category. I mentioned we were also interested in understanding the impact on other outcomes besides SARS-CoV-2 infection and hospitalization and death. And just as an example, here are some of the data we found on anxiety symptoms at baseline. We measured anxiety using the GAD-7 instrument, and we saw that about 36.8 or 37% of our cohort reported moderate or severe anxiety symptoms at baseline. And if you take that 36% that we saw in the entire cohort and start to look at what proportion of people in different groups were experiencing moderate to severe anxiety, you can see some of the groups with higher levels of anxiety, much higher, included the frontline healthcare workers, those that had reported COVID-like symptoms, people who had been tested for SARS-CoV-2, people that had a COVID diagnosis, people who were hospitalized, as well as those who had a loss of income as a result of the pandemic, and those that needed care but couldn't access it. So that was what we learned from the baseline enrollment assessment of our cohort, but we're going to be following people going forward in time, and we've already started the month 1 assessment of our cohort, which is going to include collecting a dried blood spot specimen through the mail at home, self-collected, so that we can do serologic testing to look for exposure to SARS-CoV-2 or prior infection with SARS-CoV-2. We've also deployed a unique daily symptom tracker app, which many of you in the room may have come across. It's an app that reminds you to report information on any symptoms you might be experiencing on a daily basis, and kind of aggregates them together and is using it to track the spread of SARS-CoV-2 by monitoring the kinds of symptoms that people are reporting. This is showing some of the large realms of measurement that we included in the cohort, things that we measured at baseline. I talked about a fair number of these already, and then the kinds of things that we're adding at the 1-month assessment, including things like trust in government to prioritize the safety of its citizens, food and housing security. We're adding questions on depressive symptoms and social support, interpersonal violence, substance use, unhealthy drinking, and the willingness to donate plasma to help others who may need it. I mentioned that we're doing at-home serologic testing through the mail. We've already started mailing those kits out to our participants last week, and beginning to receive some of the specimens back. This is an example of the card that comes along with the specimen collection kit, so the participants have instructions on how to do it. We did a small pilot of this procedure before we launched it on a large scale to get a sense of how it worked for participants. And this is a picture showing the specimen collection card and the mailing envelope for one of our participants, and they reported that the process worked smoothly. In terms of the serologic test, the specimens that we will be getting will be stored at -80 because we're still waiting for an acceptable validated serologic test for dried blood spots. We expect one to be coming soon that our lab can deploy. And we also don't have funding to actually do the serologic test. We submitted a very large grant proposal to the National Institute for Allergy and Infectious Diseases at NIH to pay for this. And our hope is that we hear in the coming week or two about whether or not they will fund the serologic testing for this. The test that we will, or that we're looking closely at right now is the Euroimmune serologic assay. It was just given the emergency youth authorization by FDA for IgG and serum and plasma. And it's currently being validated for DBS, and we hope that that will be ready to go in about 2 or 3 weeks from now. So what are we planning to do going forward? We're going to use the data that we're collecting to determine the impact of non-pharmaceutical intervention implementation on SARS-CoV-2 outcomes. We are going to also look at the impact of non-pharmaceutical interventions on psychosocial outcomes. I've listed the wrong outcomes here in the bullets, but these are things like anxiety and depression and post-traumatic stress disorder, as well as problem drinking. And we also will be looking at, among those participants for whom we observe their seroconversion, so they have a negative test at month 1 and then a positive test at month 3, what proportion of them didn't report having any symptoms whatsoever? This is something that a lot of investigators are trying to estimate and pin down, and our study can contribute some data in this area as well. And lastly, among those with a serologic test at month 1, we want to estimate the incidence of COVID-like illness between month 1 and month 6 so that we can say something about the risk of subsequent COVID disease among those who have antibodies from a prior infection. So in other words, can we show evidence of whether or not having antibodies to SARS-CoV-2 is protective against subsequent development of disease? This is another important area of investigation that, because we've enrolled this cohort and are observing them during a period of active transmission around the US, we're in a unique position to be able to answer this question. And it is about to get worse. It has gotten better, but in many areas, but it is about to get worse. Many places have already begun to reopen or are planning to reopen. And we are collecting these specimens right at the outset, and we'll be able to observe the extent of new transmission that occurs as a result of this. We're bringing in some really unique publicly available data on mobility. Many of you may have seen this from the Descartes lab, showing how they can use cell phones to track mobility during the day. And on the left, you can see what it used to look like in these states before COVID-19 physical distancing restrictions went in place, and then how mobility really dropped a lot. And the green line here is what happened in New York. I mean, we really locked down for a long period of time, and we stayed locked down for a long period of time. It's beginning to inch up in other areas. And so we will be able to use these county level data to be able to correlate it with what we see in our cohort around behaviors as well as around risk for SARS-CoV-2. And this is just a map sort of showing the same information. This is how mobility looked at around April 12th. It was really next to nothing in most of the country. And this is a map of the same information from May 1st. It's really showing that there is, with the exception of some areas, especially in the Northeast, there really is beginning to be more movement than there has been during this long period of lockdown. So I'm going to just close with a few slides that talk about the limitations and strengths of our Chasing COVID cohort. We can't provide nationally representative estimates. We do have a national cohort. It has people from all 50 states, and it's sociodemographically diverse. but it is not representative of all people living in the US. And so that's one thing we can't do. We will probably also underestimate hospitalizations and likely won't capture deaths among our participants. What will happen is we will lose contact with someone in our cohort and we won't be able to find out. They'll look like they're lost to follow-up from our standpoint. We can't conduct state or county specific analyses for most locations. There are a few states where we have, a large sample size, like in New York and California, we have over 700 participants. And so we may be able to do some analyses that are specific to those states, a couple of other large states too. But for the most part, we won't be able to conduct state or county specific analyses. We'll be doing large national analyses that compare, say, the impact of shutting down society earlier versus later in the course of community spread of SARS-CoV-2 on longer term outcomes like the number of deaths and things like that. And of course, we're still early days in our cohort. We don't know what the retention rate is going to be, but the real value of a lot of these cohort studies is when you can retain as many people over as long a period of time as possible. But we do have a number of strengths. The timing is one of them. We rapidly deployed this cohort during the upswing of the SARS-CoV-2 pandemic, and specimen collection is going on right now, right before physical distancing is relaxed in many areas or as it's happening. It's a prospective study, so we can observe seroconversion and the development of COVID disease among those who were disease-free at an earlier time point. And we have the potential to assess the impact of different strategies to opening up society. For example, the next big thing that is coming from a public health implementation standpoint, a response standpoint, is expanded testing and contact tracing. Our cohort puts us in a position to be able to look at the uptake and impact of these strategies that we expect to see in the coming weeks and months. So to wrap up, we've learned a lot by enrolling a national cohort in terms of what's happening in communities and households and with individuals around the US in the middle of this pandemic by enrolling a geographically and sociodemographically diverse group of participants into longitudinal follow-up. But there is a lot that remains to be learned that can inform the public health response to this pandemic as well as future pandemics. So I just want to close here by acknowledging the many people at the CUNY Institute for Implementation Science and Population Health and the CUNY Graduate School of Public Health and Health Policy who made this work possible. They mobilized in such a rapid fashion in the middle of a pandemic and from one of the world's epicenters of the pandemic to launch this cohort and begin to get some of this crucial information out there in very short order. So I want to send out deep acknowledgements to this team that really came together when it mattered. So that's all I have. So thanks very much, and I'll stop slides now. I won't show you the extra slides.
Great, thank you very much. That was fascinating, and I can't wait to get to the question and answer session. And just to remind everybody that we're holding questions until after the next two speakers. Our third speaker is Dr. Weigang Chu, who's professor of biology at Hunter College. He applies bioinformatics approaches to study genome evolution, species diversification, and gene function. His focus has been on Lyme disease, and today I think he's going to be telling us a little bit about how he's applying that expertise to COVID-19.
Oh, hi, yeah. So yeah, we also kind of pivot quickly after the pandemic strikes. We certainly didn't expect New York City becoming a epicenter. But so what I'm going to be talking about is how to use genomes to track and forecasting and maybe as a surveillance tool. I think in this epidemic, and my basic message is I think the genomic sequences has a role to play in the future. And one of the reasons we didn't predict this this avalanche of cases. Yes, I don't think we didn't do enough sequencing-based surveillance and didn't do it early enough. So I want to start out by thank the ASRC, the team for the invitation and organizing this webinar. And so I'm going to start sharing my screen. Let's see. I don't have a PowerPoint, so I'm just going to share the screen because mostly I'll be introducing the web tool we have developed in the past 2 or 3 months. I begin by, would like to acknowledge my group of really highly competent and motivated team of students and scientists in my lab. You know, we, that's the first hackathon. We held on February 8th. That's when everything looks so calm and nice here, and as if it's not going to affect us. So our students are very motivated, and we've been doing Lyme disease, and there's a suggestion says, why don't we just apply what we know in terms of the genome comparisons, genome analysis, building the web tools. We've been tracking Lyme disease for years, over 10 years. Why don't we just, do this, see what we can do for the new virus. So that's what we did. We have few hackathons, and it was entirely pushed by this group of students, grad students, and others. Since the lockdown, there's no lab work you can do. That's pretty much all we're doing. I mean, we're just collecting a avalanche of sequences. These are being updated. Currently, I think there are over 10,000 sequences available in public databases. So I start by just give a brief description on this output. So far we have, it's called a COVID-19 genome tracker. So what we're showing here, the main part, it has two scales of evolution. We try to track the origin of both the origin of the virus evolutionary and also origin of the outbreaks at local levels. So there are 2 tabs. So the first tab is the tracing the outbreak strains. What you're seeing here is a network we call a phylogenetic network. It's becoming a standard analysis tool in all those publications. If you see, each node represents a group of similar genomes. In total, in this version, we have about 2,000 genomes analyzed and compared. And they collapse into about 200 we call haplotypes that represented by each of those nodes. Because a lot of genomes are the same, so they're grouped together. And the nodes are colored by geographic origin, so that's the origins are linked on the map. So you can click on that a map, and so I'm clicking a US map. It shows all the strains that's collected from US patients. As you can see, it's really diverse. We have strains coming out of from pretty much all across the world. And you can search, and so if we just type New York, so we're gonna see there was a couple of weeks ago, there was an article on New York Times says where the New York strains comes from. I think the conclusion was mostly from Europe as opposed to Asia. But on the West Coast, there are more West Coast strains, more from Asia. So this is how we are displaying here. The nodes represent the genomes, and the similar genomes are grouped together. The edges are showing the mutations. What are the mutation changes? One edge shows so this shows the phylogenetic change during the spread of the and evolution of the virus. Some of you or many of you are using, we're kind of start on this. There's a more popular tool, many of you know, it's called NextStrain. We do something a little bit different from NextStrain. One thing is they use phylogenetic tree. Let me share can you see my screen here? The NextStrain. So I just want to show the difference. They use it's pretty good. It's very similar data sets and very similar ideas, but they show with a phylogenetic tree. We show an alternative way using a phylogenetic network, which we hope is a little bit more informative, less cluttered. And the other thing that we do differently from NextStrain is we try to show the direction of evolution changes. So we include a batch sequence, which is kind of the closest non-human isolates we know so far. That's in evolution, it's called an out group. It's used to, the position of this out group shows pretty much where the most ancestral strains of the human strain comes from. So, so we include this, and with this strain, we can actually polarize or determine the direction of the mutation changes. Not just says there's a difference between genomes, we can really trace the mutation changes. So, so that's this figure. So you can search by isolate names, search by countries, and you can, if you click on the edges, you're going to see the actual exact mutations where the mutation happened on the genome. What are the amino acid changes, if any, and things like the detailed genetic information. The next part, we also have a non-synonymous, yeah. At a more large time scale, there's a tab called evolution, which puts the 2 coronavirus outbreaks in the past 10 years or 15 years. One is the SARS, and this time is the COVID, in the context of their wildlife isolates. So the first strain is the COVID strain. Then there are a group of, there are a lot of isolates from bats, from pangolin, and they're closely related, and it's obviously these are the animal reservoirs for this, as a source of this current pandemic. And the same thing happened before. Actually, this is not the first time this called a spillover from the animal reservoir to the human population. This time is a lot more scary. So that was the SARS outbreak about few years ago, but it's all the same set of kind of dynamic. They somehow spill over from their bat isolates or relatives to the human population. And then we show all the genomes. And for the genomes, what's useful for a lot of biomedical researchers, they are trying to find, we are interested in how variable each of those genes are. For example, this S protein is a focus of intense study as a vaccine target because it's located, expressed on the surface, very surface of the virus, and it has an attachment site, and it's a vaccine target or vaccine candidate. So there's a lot of interest in how variable the S protein is. So that's why we plot. If we double click on this S plot, we can actually show variability at both nucleotide level and at the amino acid level. So it's already been used. Some of our students and colleagues work in the lab. I think it's a quick way of looking up, your favorite protein or favorite parts of the protein, how variable it is. Whether it's a viable or a candidate for therapeutics or vaccines or diagnostics. So that's the introduction of the brief description of the tool we built. So how do we use it? Why? So I see there are three main uses for this tool, or it has been used in this way already since we have a manuscript in review. And first is we hope to be used as an epidemiological kind of a tracking tool for tracking either the global origin or the local origin, or I'm hoping if we can zoom in New York City origin, if Professor Nash in his cohort has any possibility of getting hold of genome sequences, and then we can zoom in on to build a more kind of a local level genome tracker. So that's one use for as an epidemic tool for epidemiology. Second use, it's already been used. It facilitates researchers like to either for researchers who are interested in the mining the genomes, for the genome functions, gene functions, or targets or candidates as a drug targets, things like this. And also for us as an evolution biologists, we're interested in how often mutation happens, whether there are recombinations, whether there are key mutations we can zoom in. For example, there's a lot of publications on this mutation. This is spike protein. It's called a D614G mutation, and I think we found about a month ago, and a month later, like last week, we saw 10 papers publishing on this. So this tool, obviously we're not going to be able to claim a discovery, but this was showing up on our tracker long before all these people. So this shows the use of this tracker comparison. We try to build something more real time, so important discoveries can be found a lot more quickly. Third use, I think we're hoping as to build this as a more appealing tool for public outreach and education, as a way of understanding what's the nature of this virus, how many genes, how genes vary, and also how evolution happens. Evolution happens on those by stepwise mutations, and it's a phylogenetic process. For my teaching as well, it's been a great tool for me and my students and others to teach evolution in our courses. I hope, and we also hope that this way of network way of conveying the virus evolution is a little bit more accessible to the general public than the next strain, which is phylogenetic tree format. That's what normally used. So for the future, we really look forward to see if there's a role we can play for public health initiative, including the public health institutes in CUNY, collaborating with their researchers for modeling the diseases, tracking the diseases. Especially New York City being the epicenter of this of disease. I think we have a lot to do. One experience from doing this is I'm really frustrated by this lack of total inactivity during the window of time in February. Apparently, now we know. I mean, after this kind of looking backward. In the site, the virus has been evolving, has been spreading widely. I just wish somehow we have been tracking, sequencing, taking samples from students, just random samples, even like cohort samples, sequencing the specimens, non-symptomatic symptoms. I think if we do this a month earlier, this would be apparent. It would really be we could have stopped the virus outbreak. But at that time nobody had this data, of course. But hopefully this will if we have enough of the capacity for doing things like this, we will be able to prevent the next disaster like this. And there is a national effort, I think, of doing this sort of genome-based surveillance sequencing of non-symptom cohorts, and then collate or collect or share all the genome sequence together. And I think that will be a lot more effective than start doing the social control and social distance, all those lockdowns after the fact. It really has to be proactive about a month ago. So that's all I have. I don't know how much time I took, but yeah, thanks for all of you who listening in.
Great, thanks very much. That was wonderful. Again, looking forward to the questions later. Our last speaker, Dr. Adam Braunschweig, Associate Professor in the ASRC's Nanoscience Initiative, as well as in Chemistry and Biochemistry at Hunter College. His lab works at the nanoscale interface between organic chemistry, I just lost my notes, chemistry and material science, looking at a bunch of different impacts. One of the things he did recently was look at how his work could potentially point to antiviral treatments for Zika. And I think today he's going to tell us a little bit about how that may also play a role in identifying antivirals for COVID.
Thank you. Thank you for organizing this. Today I'm going to talk about, as Nina said, antivirals for Zika. And that's because I can't talk about our work against COVID yet because of disclosure reasons, but I'll tell you our anti-Zika story, and then I'll ask you to draw connections between our previous work and what's going on now. What my lab has been working on for the last several years is developing antiviral drug candidates against enveloped viruses, which includes AIDS, Zika, dengue, chikungunya, many other emerging threats, including COVID. So these are viruses with coating of proteins with sugars on them. And what I'll tell you about is our novel strategy for developing new drug candidates. So it's going to be a tour of medicinal chemistry, and the work you'll see here comes out of my lab at the ASRC, and we've done a lot of this in collaboration with other people, including Mateusz Mariański at Hunter College and some collaborators at Texas Tech who have done the virology research for us. So the big idea that we have is that the surface of every cell and virus is coated with a layer of carbohydrates. So this is what carbohydrates, this is the cartoon representation of carbohydrates, and they're very complex molecules, so we use these cartoon representations. And the big question we have is, can we make drugs that target these carbohydrates on the surfaces of cells? What would that do? These carbohydrates are involved in binding between the cell of the host being the person, and the virus. So if you can develop a drug that binds these carbohydrates, you're going to prevent the virus from entering the cell, replicating, and causing the disease. That's the big idea, but it's not so easy. But why would this idea be valid? What you're seeing here is mass spectrometry on the envelope virus glycans of two different strains of Zika virus. What this shows is the viruses, the carbohydrates or glycans that are present on the surface of the different strains. And what the peaks show is both the intensity of the peak is the prevalence of that particular sugar on the viral surface, and the geometric shapes below are the cartoon representations of the glycans. And the big takeaway from these two different images that you're seeing is that different viruses and different cells represent different carbohydrates or present different carbohydrates. So if you can build a molecule that binds one carbohydrate and not the other, you'd be able to target, for example, carbohydrates on the virus and not target carbohydrates on all the other cells. So our challenge is to build small molecules that might, for example, bind this carbohydrate that would be present on the surface of Zika, but not something like this that might be present on the surface of other cells. And in that way, we can prevent the virus from spreading and minimize off-site toxicity. That's our approach. And the differences in glycosylation, or the carbohydrates that are presented on the surfaces of the viruses, are subject to rapid mutation. And that's why, or the different carbohydrate representation on different viruses could explain human-to-human transmission, animal-to-human transmission, and may be also responsible for the rate of spread, or this R0 factor that we have all heard about. So carbohydrates play a central role in the virus life cycle and representation. The big problem is there are currently no drugs on the market that target carbohydrates, despite their central role in the viral life cycle. In other words, carbohydrates are what are called undruggable targets. And what that means is we know as scientists that this particular molecule has a central role in the disease progression, but we have no way of using this knowledge pharmacologically. In other words, we can't use this knowledge to design anything useful. We'd love to, but we just haven't been successful at doing it. So what I'm going to walk you through is my group's approach to addressing this undruggable target problem in an effort to create antiviral treatments. So we were not the first to think of this. Several groups have created these molecules called synthetic saccharide receptors, shown here, and it has been an abject and absolute failure. Despite the efforts of people a lot smarter than us, people have not been able to develop molecules that bind carbohydrates. And I'm going to give a very brief overview of the chemistry behind this and a little bit of the history on why it has been such a failure. But in essence, all of these molecules bind one carbohydrate, glucose. Glucose is something that's prevalent in the bloodstream, but is never present on the cell's surface. So they bind one carbohydrate, but not one that has any use. So let me take you all back in a little chemical history and tell you what has guided the design of synthetic carbohydrate receptors. This is Donald Cram. Donald Cram received the Nobel Prize in Chemistry in 1987, and he developed a field called supramolecular chemistry, or host gas chemistry. And this is an effort to create small molecules that act as hosts so that bind other small molecules. And through these efforts, what he developed was two rules called pre-organization and complementarity. Complementarity tells us that positive binds negative. So plus will bind a minus charge. But the other is pre-organization. And what he said was that the more pre-organized or rigid a molecule is, the more likely it will bind strongly its target. And that's true for most protein-substrate interactions. Most proteins are very pre-organized, and the drugs that go in them are very rigid. The one exception in nature to this, or one of the most prevalent exceptions in nature, is the proteins that bind carbohydrates. The proteins that bind carbohydrates break all of Cram's rules. They're flexible and they're promiscuous, meaning generally they bind all carbohydrates, but just bind one ever so slightly more than the other. So what we sought to do was build a molecule that followed these principles, not the traditional principles of host gas chemistry. So that led us to this design, which we called designing for luck. basically what we did was we made the most flexible molecule we could, and then we added a lot of hydrogen bonding groups that would stick to carbohydrates. We hoped to get a hit, gain some knowledge, use this knowledge to design the next generation that would be more specific, more potent. So we just started from the principle that we really knew nothing, but if we learned a little bit, we could build on that to build more effective compounds. So this was our first molecule that for reasons that have been lost to history, we called bear paw. So bear paw was our original compound, and we have a whole family of bears now that have been evolved from this. What we did was we took this molecule and we tested the binding against very simple carbohydrates. And what we do typically is what's called NMR spectroscopy. So we add one to the other, we look at peak shifts, and then we fit these curves here, the movement of different protons in the spectrum. We fit these data to different binding models to figure out what carbohydrates our molecule binds most strongly. So here are two different carbohydrates, and you'll see the data changes in different ways. So for example, you can see when we're looking at the binding to this particular sugar, you can easily fit the binding using a one-to-one model. But for something like mannose, this sugar here, we can only explain the data if we see that mannose is bound. If this is our receptor bear paw, mannose gets bound 2-to-1 in this cage-like complex. In other words, what we did was we took our molecules, looked at a lot of different sugars, and looked at differences in binding to see if we could find trends. And then this is what some of our complexes look like. You see the sugar in the middle and our molecule, our potential drug, hanging around it. And something like glucose, you just have 8 contacts, but mannose, you have 13 contacts. Just like the natural model, just a little more strong binding leads to selectivity for mannose. So this was the knowledge that we gained, and we asked ourselves, how do we build on this for more mannose-specific molecules? Right, so basically what we do in my lab is we build libraries of compounds using organic chemistry. So we start with a simple precursor here, and then we elaborate the structure into different receptors, dimeric receptors, whole families of different structures, and we just continue to explore the binding to see if we can find trends in selectivity, get molecules that may bind this carbohydrate but not the other. Then we look at the carbohydrates on a particular virus surface, and then we say, this is the perfect drug because this virus overexpresses this carbohydrate but not the other one, and we have found that this drug is specific for this carbohydrate. So the point is we use organic chemistry to make libraries. We screen those libraries using the same approach that I briefly discussed. We find the same trends, we fit the data, and then we look at selectivities. And this is what our selectivity initially looked like. So here you see our different receptors. We use the abbreviation SCR for synthetic carbohydrate receptor. This scale here is the binding strength. And what you'll see here is that pretty much every receptor binds every carbohydrate. So they're promiscuous, just like the natural carbohydrate binding proteins. But if you look here, SCR001, the original bear paw, is just ever so slightly more selective for mannose. And mannose is a great target for reasons that I'll get to in a little bit. So we went to see if we could extend this selectivity by designing a third generation of receptors, and that's shown here. We found that really the only thing that matters to us is the composition of the heterocyclic side chain that goes right here on the structure. This was the single most important factor that would dictate the selectivity of our receptors for different sugars. So we made our generation 3 library, and this time we assessed it, and we got what we think of as specificity. So before, these original receptors were selective, meaning they might bind one ever so slightly than the others, but they still bind everything. But now what you'll see is our receptors just bind one sugar, right? So this one just binds glucose. SCR18 binds almost entirely mannose and a little bit of galactose. 19 just binds beta mannose, etc. So in other words, in 3 generations of iterative design, we've come up with completely selective receptors for different carbohydrates, which can then be used for targeting viral surfaces and minimizing off-site toxicity. And we did that starting with a very simple premise of designing flexible molecules, studying binding, and then building on the knowledge to bind to build new libraries. And this is what some of our complexes look like. They're very complicated. And what this is meant to show is that we were right to pursue the idea of not trying to design. It's just too complicated to design these sorts of binding structures. So rather we just kind of let luck do the work, and we just figured out retroactively what they look like. They make a lot of really cool structures with the sugars. And then, okay, enough with that. Let's look at the actual antiviral activity. Zika is a great model for COVID because it's an enveloped virus and they display a lot of the same sugars. What this cartoon here is meant to illustrate is that the initial recognition between the host and the virus is mediated by these carbohydrates. So in other words, if you could get a drug right in here, it would stop the virus from binding. Zika has a lot of other similarities to COVID in the way that it spreads. Zika is driven by, to northern latitudes by globalization and global warming. So we need to be prepared for more of these viruses in the future, and we need versatile strategies to combat them. Like COVID, there is no approved therapy specifically developed for this disease, despite all our efforts. So there's a lot of similarities between Zika and COVID, but I can only discuss the Zika data now. So what did we do? We looked at the inhibition of our different receptors against Zika. What we used is something called a reporter virus particle assay. So our cells express green fluorescent protein when the virus goes in. So the more fluorescence there is, the more the virus is replicated in the cells. And what these show is traditional inhibition curves, meaning that our molecules prevent the virus from replicating in the cell. We plotted this side by side with suramin. Suramin at the time was one of the molecules that the CDC was looking at to repurpose to combat Zika. But what you'll see is we couldn't even plot these data together because our molecules were about 2 orders of magnitude more potent than the molecules that the CDC was looking at for repurposing. And then all the rest of these data are meant to show that our hypothesis that the molecule, that our synthetic carbohydrate receptors operate by inhibiting endocytosis. This is all supportive data of that premise, which I'm not going to walk through, but you can find it in this paper here. So our molecules are potent and they work by inhibiting endocytosis, or the entry of the virus into the cells. Oh, and this is the raw data. So down here we have suramin. What we have here are 2 numbers. So we have the IC50, this is the inhibitory potential. The lower this number is, the better. This is the toxicity. The higher this number is, the better. So against Zika, we have one particularly promising candidate with very low IC50 value. We call this nanomolar inhibition, and relatively high toxicity. So the ratio of one to the other is greater than 100. So we would call that a promising candidate for pursuing in clinical trials. And we have even more promising data for COVID, with a lot more data of how it binds to specific COVID glycans. We've pushed that aspect a lot further, but hopefully you'll be hearing about that data very soon, but I can't disclose that yet. But we have found one very promising candidate amongst these for COVID, and we have 3 others that would be secondary candidates. So we have one molecule with nanomolar inhibition against COVID and a very high TC50, so the ratio is about 150, which we consider very promising. And the people who did the virology work, Dr. Himanshu Garg and Anjali Joshi at Texas Tech University Health Sciences Center. So let me just talk for a second about how the strategy goes well beyond viruses. So this is a chart showing different cancer types and then the different sugars that are overexpressed on the surface. So you can see sialic acid, that's one carbohydrate, is overexpressed on the surface of pancreas, blood, breast, colon cancer, etc. Glucose is not a good target. It's only overexpressed in blood cancers. Mannose, which is as close in structure to glucose as possible, is on the surface of many cells, and I could go on. But the point is, carbohydrates are still considered undruggable. But if we could figure out a way to target these with drugs, it could be revolutionary for a whole series of different diseases. Right now, we're focusing on viruses, which is an impactful choice now, but in the future, we'd like to explore the strategy well beyond viruses, although I find viruses very interesting and very important for obvious reasons. And then this right now, this is a little outdated, but we have about 30 or so of these molecules in our arsenal. And what we do is we just throw them at all the different diseases that we're interested in, and we look for hits. Okay, in summary, we figured out some of the rules for binding different carbohydrates. And we did this by following a kind of try to get lucky strategy, a little more complex than that, but we now have a suite of about 30 molecules. They have antiviral activity, in particular against COVID and Zika is what we've looked at, but we also have data against dengue, chikungunya, yellow fever, Ebola, etc. And we hope that this could be a general platform and that people start looking at carbohydrates as a viable drug target. Okay, so the people that did this work, these were our virology collaborators. The computational work that I only showed briefly here was done by Professor Mariansky Hunter, Kalanidi, Fernando, Frank, Yasser, and they were the main contributors, and they did a tremendous job. And thank you for having me.
Thanks, Adam. It's great. In the interest of time, we are actually going to skip directly to our breakout discussion section. So you have more of an opportunity to engage directly with the speakers and talk about what their work is, what your work is, and how maybe we can increase collaborations and accelerate work on COVID-19.